David, why is screening and early detection for osteoporosis important? And then how often should somebody have a follow-up test, and how often should they be assessed for osteoporosis?
Well, screening is important because osteoporosis is a silent disease until somebody gets a fracture. And the purpose of screening is to prevent that first fracture. So it's much better to diagnose the disease before it results in a clinical endpoint, like a hip fracture or a spine fracture, than after the fact. So generally, most osteoporotic fractures tend to happen in older individuals. So even if somebody has their first DEXA, as is commonly done at the age of 65, hopefully, if a high risk is identified, they can modify their lifestyle, maybe get on a therapy, which will lower the risk of future fracture. In general, most insurance companies, third-party payers will pay for DEXA, reimburse for DEXA, if it's done every 2 years. Now, under some circumstances, you can get it done a little bit more frequently than that, say after 1 year. And that's if you're at very high risk of fracture, or if you've already had 2 fractures and you've diagnosed a very rapid rate of decline, which could be picked up faster, and you want to identify if the therapy is having an effect sooner rather than later. But in general, the frequency of DEXA is every 24 months.